So, tips for traveling with disease and illness. Let's go into tip number one, which is preparation. The first thing I recommend is to meet with your medical team. That is to discuss and understand what's expected from you before you travel and while you're away traveling. I highly recommend to take notes on this, to bring somebody if you have a caretaker, and to write down everything that's needed and when it's needed so you can get to work on researching medical centers in the area that you're traveling to and making sure that they provide all of the tests needed to schedule tests ahead of time, to understand out-of-pocket costs, and anything else that's needed. So I did mention I'm a travel full-time, and right now I'm living in Baja California in Mexico. So I do have traveler's insurance. However, it only covers me for emergency hospitalizations and medications. So while I travel, I do out-of-pocket blood work as a transplant patient, and I do that bi-weekly. So before traveling to Mexico, I actually researched labs in all of the destinations that I was traveling to. I was able to find their phone number. I was able to go on WhatsApp and message them and send over my tests so that they could confirm that these tests could actually be done where they were. And then I was able to ask the out-of-pocket costs for these tests. This allowed me to go in knowing that it was possible to get the blood work out of pocket. So it opened up the doors for me to go anywhere that I wanted to. But the unfortunate part was paying out of pocket, which is about like $250 each blood test that I get. So that means that I may decide to travel to less expensive destinations so that I can budget in these out of pocket costs. Next is ordering medications and supplies ahead of time. I count all of my medications before I leave, and I pack at least 50% more medications than needed. So if I'm going on a trip for 2 weeks, I'll pack 1 full week of extra medications in case you have an emergency, you end up in the hospital, and you can't get all of those medications at the hospital you're at, or your flight gets canceled or something. I also recommend you pack all over the counter and prescription emergency medications separately. By packing them separately, it'll allow you to put it in whichever bag you have while you're on the go. One example of really making sure that you pack these medications. I went to Hawaii and I was hospitalized, and the island actually didn't have the medication that I needed, and they weren't able to get it in the time that I needed it. So I wasn't expecting it to be there as long, and this was a medication that was like critical to my care. So I actually ended up having to fly a friend out to bring me that medication because it was cheaper. Well, really, it was the only way I could get the medicine right away, but that all was out of pocket. No insurance was going to cover that. One tip that I've learned over time is something called a vacation override. This is something that you do when you call your insurance company and you can ask for a vacation override. Usually that means they're going to give you double the amount of your maximum that you usually get. So if you have a medication and it gives you 30 days usually, you can get approval for vacation override and it will give you 60 days. And that allows time for you to travel and be away. And if you're abroad, I highly also recommend to research where you're going, if there's any shots that might be needed, and prepare yourself for any potential diseases that you could get overseas, and ask your doctor for medications ahead of time in case you do get that. Maybe you don't have to be hospitalized if you already have medications that can treat this problem. Like for me, being in Mexico, if I were to accidentally drink the water and get sick, I have medications that will help with a stomach bug now. Of course, I'm going to call my team and talk to them before I start it, but at least I have it on hand and can start it right away. So let's talk about tip number two, which is insurance plans. Insurance plans, on the next slide, please, is designed to give travelers peace of mind and financial protection against the risks of travel. So there's usually 3 types of coverage for insurance plans. It's protection for your financial expenses, protection for your well-being, and protection for your personal belongings. I'm solely going to talk about healthcare travel insurance in this presentation. Travel insurance usually costs about 4 to 10% of your overall travel. So if you travel for a longer period of time, it's going to cost more. There's budget plans out there, but they cover a lot less. So you want to read the details very, very closely. Domestic and international trips are fairly similar, except for the fact that when you travel out of country, they may not have access to all of the same resources that we have in the States. So you do want to do all of the intense research you can. Domestically, traveling means that you're traveling in your own country. You can call your insurance provider or go online to understand what's covered. If you're traveling out of state, it's best to ask if you're covered for x-rays, hospitalization, or even evacuation. If you do have government state insurance, you can call your insurance plan and ask what the steps are to gain temporary insurance in the location that you're traveling to. And usually they're able to help you with that as long as you do it far time ahead of time before your trip. International, check your insurance for the length of time that it covers. If you're going somewhere like Europe and you're going to travel to a few different countries, you want to make sure that you get a multi-trip policy so that you're covered in all of those different places that you're going to, because insurance will look at it as a separate trip from just going to Spain to go to Italy. And plan for worst case scenarios. You want to think, if you're going abroad, how long will it take you to actually get evacuated from where you are? What are the steps to do that? And then make sure you're covered. I have 3 examples of the top traveler insurance on the market right now, which is Cigna Global, William Russell, and Geo Blue Explorer, which is what I have, and I really like it so far. On the next tip, number 3, the next slide, is packing medications and supplies. This is a big one. I always recommend that you try to pack as much as you can in your your carry-on bag if you're going on a plane, because that means that it's going to usually be with you and you have your eyes on it at all times. So how do I pack? Well, this is something a skill that I've kind of adapted over time. The easiest thing for me to do to pack all of my medications and supplies, including emergency medications, is to make a list. So mentally make a list and then write everything down so that as you're packing, you can cross things off your list. A way that I organize is actually by organizing by category. So I can do this by disease or by organ. I usually do it by organ because it's easiest for me. So I think lungs. What is everything I need to go on this trip with my lungs? My nebulizers, my inhalers, etc. And then I'll move on to my pancreas. I'll pack enzymes, insulin, all of that stuff. And I'll check it off as I go down my list. And once I've gone through everything, I'll actually switch and go over my specialties and my illnesses. And then I'll cross-reference like that to make sure that I have everything packed. I organize all of my medications into weekly organizers. Just as Greg says, it is a time saver. It's super helpful. And this will make sure that everything is already packed. I do recommend, if you pack in weekly organizers, to tape around, because I have had one of my organizers explode on the plane and all of my pills were everywhere. And it took me a few hours to get everything organized and pack them back in the weekly organizers. If you have a transplant or something else where maybe some of your medications can vary on your dosages, pack that bottle on the side, and that will make sure that you remember to put it in your bag separately. And I always pack all of my emergency supplies, over the counter or prescription, separately. And I was gonna bring the little example of how I pack them, but I forgot to put it over here. So basically it is a separate little like container, like pocket thing, and I can open it and it's labeled 1 through 10, and I have a key on the back that says 1 through 10 what each thing is. And I'll bring that in my purse, in my backpack. Anytime that I travel, I'll bring that with me. And even though I'm saying pack everything on your carry-on, I do recommend that you'll pack at least 1 week or at least a couple of days of extra medication in your checked luggage or with your travel companion. If your bag was to be stolen, it's going to take a lot of time and effort for you to go to the hospital or to fly home or to just acquire all of those medications all over again. So, I also advise you, if you are going to pack medications, you can bring a separate personal item on a plane with you. So airlines actually allow you to bring an extra personal size bag on the plane full of medications free of charge. I recommend you go to the airline, you print the policy, you print a list of all of your medications with your doctor's letterhead signed by your doctor and bring it with you. So if you do encounter somebody that maybe isn't as welcoming to this or doesn't know the policy, you can show them the policy and they will let you straight on the flight. Do not pack anything other than medications. They are subject to check. And if you have any personal items, they can charge you for that extra bag. So tip number 4, let's go into it on the next slide. It is researching medical access in the area of travel and mentally preparing. Researching hospitals. Researching in the area or areas that you're traveling to get an idea of which hospital you preference going to in case of an emergency is highly, highly recommended. I ask myself questions when I travel, like where's the closest local hospital? Where's the closest CF accredited center? Where's the closest transplant center? And if I had my choice, which hospital would I want to be taken to? This is in case there is an emergency. You can tell, an ambulance or a cab driver where to go really, really fast. You don't even have to think about it. It's already on your mind and you know exactly where to go. I would recommend also forcing yourself outside of your comfort zone to mentally prepare and think through any emergency situation that could happen. By doing this, it's really uncomfortable. It may trigger some PTSD, but it allows you to go through all of these steps in your head ahead of time. And then later on, it'll take the stress off traveling because you already know who you're going to call and steps 1, 2, 3, what are the first things you're going to do to get help. I recommend leaning on support systems and sharing with your travel companions and emergency contacts where you'd want to go and what to do in case of an emergency. They may be able to advocate for you if there is an emergency. So something that was really bothering me, stressing me out is on my first international trip, I was really stressed out about my concern for dehydration, constipation, and all of my CF stomach issues. I had that happen in the past where I was traveling and I ended up being on a ventilator because of this and brought back to the States, and it was a really long recovery. I voiced this to my travel partner, who at that time was my husband traveling with me to Japan, and I told him, I'm really stressed out. I don't even know if I can do it. I just have so much anxiety about this trip. And so what he did was build a checklist for water going in a month before our trip. And every day I had to have the amount of water on there, check it off 1 month ahead of time and during the duration of our trip. And I will tell you, it gave me peace of mind that I did everything possible to put myself in a positive circumstance for it not to happen. And I was in control of that. A pro tip traveling abroad is to download Google Translator app ahead of time in the language of where you're going and to learn the emergency contact numbers in the language or in the country you're going to, as well as the words for help or emergency or fire. All of those words are really good to know and to save in your phone so that you can immediately ask for help if needed. So tip number 5 on the next slide is documents. This is a really straightforward example of the documents you need when traveling domestically or internationally. You can screenshot this, you can ask for these resources afterwards. A lot of them are the same. However, if you travel internationally, you're gonna need a few more papers and than if you're traveling domestically. So contact information on the next slide, tip number 6. Is contact information, emergency information. No matter what stage of health you're in, I recommend traveling and carrying emergency contact information with you at all times. So what I do is I actually print a list of all of this information that you see here, and I print multiple copies of it. If I don't have a printer, which I don't in my van when I'm traveling, I just write it down on a piece of paper and I use tape to faux laminate it, and then I put it in my purse, in my backpack, in my carry-on, in my husband's bags. I put my emergency contacts everywhere. On that, I have my personal, in case of emergency contacts, as well as my travel partner contact. And I specify who's traveling with me. My contacts of my hospital, my doctor, and I put a list of my diseases and illnesses, as well as anything that would be like keywords for somebody if they found you on the side of the street to know, which would be insulin dependent diabetic, organ transplant, a list of my allergies, so that if they need to treat me Like as soon as they see me without even looking up my name or knowing who I am, they'll see that and they'll know, oh, don't do this, or hey, do this, she may have these issues. I distribute these in all of my bags, like I said, in case I'm found with one bag and not the other. And then I also bring a printout of the manufacturers of any devices I have. So if you have a nebulizer or an oxygen concentrator or feeding tube device, I print out those manufacturer numbers. When I went on my honeymoon, I was dependent on oxygen, and I traveled with a portable oxygen concentrator. And about day 3 of our trip, my concentrator actually stopped working. It would only work when it was plugged into the wall, which was going to be a huge problem because we had all these plans to sightsee and be in the car and take a drive. And so what I did was I pulled out that manufacturer number, called them right away, and within 24 hours, they had a new oxygen concentrator to my hotel door and everything was fixed. So having those printouts just saves time from looking online, which I know we can all do nowadays, but it's just great to have it there and have it ready. So on the next slide is tip number 7, accommodations. The most simple way to think about accommodations is to think about what are must-haves for you and your travel partner. This doesn't mean what do I want, what sort of place do I want to stay. It's more of like what medically is necessary for you to travel in a safe way. So, for example, if you're on an oxygen concentrator or something that needs to be plugged in, you most likely probably won't go camping. Nowadays, there are ways around most everything. You can use solar power, you can use a Jackery if you want to camp. But if you are going to use these, you know, adaptive ways of charging, I would get them ahead of time and I would try it out at home before traveling just to make sure that they're able to power everything that you need. But when I used to travel and I'd have like a million different devices on me, I'd actually prefer to stay in a hotel rather than an Airbnb. And the way I thought about that was if I had a problem where the outlets go out, electricity isn't working, well, they can instantly help me. They can change rooms, they can get somebody up to me right away. But otherwise, really, in an Airbnb, I'd have to call for help. I'd have to get the hose. It'd take many more steps to get help. I also want everybody to keep in mind proximity to hospitals, clean water sources, and food sources. If I'm in Los Angeles, it may take me over an hour to get to the hospital I want to go to if I'm staying somewhere across town. But if I stay real close to my center, it might take me 5 minutes to get there. So I have a better opportunity of going to my center in case of emergency and not being taken somewhere else. Another thing to think about is weather or any other thing that could kind of sway the way you pack. If you are in snow, you want to pack extra things like gloves and things to keep you from getting pneumonia, or extra things for hydration if you're going somewhere salty. And then lastly, you would think about your own budget and preferences. So number 8 is contingency plans on the next slide. And I want everyone to keep in mind different contingency plans. If you're planning, it's never fun to think about these unwanted interruptions. However, with chronic illness, it's just necessary. I cannot count the number of trips where I've needed to lean on my contingency plans. You can talk to your doctor about this. Usually my doctors have actually had me come up with them and just talk them over with them to make sure that I've thought everything through before I travel. Last summer, I went to Alaska with my husband and I was not feeling myself. I felt off. Nothing was wrong though. And I kept calling the hospital saying, I'm feeling off. I don't know what's wrong. I'm feeling off. I don't know what's wrong. I called them for like 6 days in a row. And then I made the call and I went to the emergency center and I drove like 8 hours to get to the main hospital in Alaska in Anchorage. And I knew that that was the hospital I wanted to go to because if something was actually wrong, I'd want top-notch treatment, which was going to be there. And at first, I tested negative for everything. And I was like, I know something's wrong in my gut. So I got discharged and I stayed really close to the hospital because I just felt like it wasn't right. Well, I ended up getting a positive for a blood culture and I was hospitalized there. And so I was happy with that because I felt most comfortable being there. And so I did all that research ahead of time, which was really great. On another trip, I went to France, and I talked over if I got COVID-19, what would I do? Would I have to fly back? Would I stay there? What would happen? And going to Europe was totally different because I was able to have top of the notch hospitals, and I could just go to the hospital there and they'd have the same treatment as they would in the US. So it was really great. Don't just assume when you travel that you're going to get your most common lung infection or something that you normally battle. Think broader to the area. If you're going to Africa, think about what types of risks and infections you could get there, and then pack the medications ahead of time. Like I mentioned before, talk to your doctors about that. I'd also recommend talking to your travel partner about your contingency plan so they can advocate for you if needed, and to lean on your resources and your village. If you have people in the state that you're traveling to, you might want to contact them and let them know, hey, I'm coming. Is it okay if I call you if I ever need something? This is my plan, and talk it over because you may need somebody to actually advocate for you. So if we go to the next slide, number 9 is it takes a village, which just means leaning on your travel partner and the people around you and talking things out with them, telling them where your emergency contact lists are, where your list of medications are, and all of those things. I went to New York and I was visiting my best friend, and this was like the same year as my transplant in 2018. And I talked to her, she was really familiar with my CF and everything that I do, but I just talked to her about where I'd want to go, what would needed to be done if I did encounter this common infection that happens for me. And it happened. I got this infection on the plane. I tried to battle through it the first night. I couldn't. I woke her up in the middle of the night. She took me to the hospital, and thank God I actually prepped her on how to advocate for me properly, because I was giving pain medication. And, even though I can talk for myself, I was in so much pain that it was really hard to advocate for myself. So, number 10 is just to have fun, everybody. Enjoy your trip. And remember that health is number one, because without your health, you really can't have fun. You'll have to go home or, take time to think about your health when you want to think about having fun.